may have asked you to perform some tests at home. Now, the reason we do that, we call it health hacks because there's fancy ways to find some of the information that we ask you to determine at home. But if we can do it simply, for no cost, in the comfort of your own home, we prefer that. So what do these tests mean, and why do we ask you to do them? Oftentimes, there's simple regulatory things that are going on in your body that if we can see, it will give us answers for some of the other symptoms that you're struggling with. For example, baking soda. If you find that you have low stomach acid, what that will often mean is that you're not absorbing nutrients like you should, so you probably have some nutrient deficiencies, and that may be causing some of your other problems. You are probably not getting nutrients that are necessary to create neurotransmitters. Neurotransmitters is a big word that means happy hormones. So a lot of the serotonin and things that make you happy are created in your gut. If you aren't absorbing the nutrients necessary to create those happy hormones, you're probably not feeling so happy. You're probably feeling depressed. So we can oftentimes identify the reason for that depression and get you off of those medications. Other things that we can identify through stomach acid, we can often identify why you feel lousy. You know, when you eat food, and it doesn't matter what food you eat, you still just feel lousy. Oftentimes that stomach acid test can give us some clues as to why that's happening. So that stomach acid test is an essential test, and we ask about 90% of our patients to do it because we want to know, what is your stomach doing right now? Iodine test. Okay, this one's a big one for us because the thyroid is the thing that keeps you going and doing the things that you want in life. Iodine is absolutely essential in thyroid function. It is the mineral that activates thyroid hormone and turns it on. So if you don't have iodine, you're not going to have adequate thyroid function and you're going to feel run down. I know if you'll talk to everyone, most everybody I talk to feels like maybe they don't have as much energy as they would like. This is probably one of those reasons. So iodine test, super simple thing to do. Just let us know the results and we'll let you know what to do about it. The other thing that we often test is the Barnes thyroid test. So that one tells us temperature. If your thyroid is low, your temperature is going to run low. That's what that means. It's a simple and easy thing to just rule that out. Some of the tests that we do in the office, why do we do those? We test your pH, and that is your mouth pH, which does relate to your overall body pH. What that means is, does your body have the voltage or the energy it needs to run your bodily functions correctly? Often it will identify that there is something sapping you of energy, literal energy. I'm not talking just, oh, I'm tired energy, but I'm talking literal electrons in your body because that's what pH measures. So if there's something sapping you, and oftentimes it's dental infection or dental restorations that are metallic, it helps us identify that. Some of the other things we do, we test galvanism, which is the frequency or the voltage of metals in your mouth. What is it doing to you? What is it taking from you because of all this metal in your mouth? So we test that. Another really cool test that we do that I've just added is called heart rate variability testing. What this heart rate variability tests is it tests what's called your autonomic nervous system. This is your number one regulatory system in your body. It's the thing that gets you up and going. It's the thing that turns you off at night. We can identify if you have weaknesses in either of those systems and what your body is doing because of that. Not only that, we can often identify why you have those weaknesses. We can identify acute disease, we can identify chronic disease. I can even find out if you've had a closed head injury, if you've had a concussion or something of that sort. I can identify if you've been overtraining or undertraining. I can identify a lot of things on that heart rate variability test. It also shows what's your reserve. So it shows us, are you able to heal? Because that's very important if you're going to be going through dental restoration work. Are you able to heal? And if you're not, if you don't have a lot of reserve right now, you're going to heal very slowly. So we need to rebuild that before we ask you to heal. So there is a rhyme and reason behind the tests that we do. And this is why we do them, because we want to know how you tick before we help you to tick better, basically how we help you improve your wellness. So we are excited to share these things with you and hope that this is actually giving you some hope as well to be able to feel better.